Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the June 2nd, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 4 new COVID-19 cases since yesterday and 9 cases since my last report on Friday, May 29th. As of June 2nd, Dubuque County has 350 positive COVID-19 cases. That's a rate of 361 per 100,000 population. 2 additional deaths have occurred since Friday for a total of 20 deaths in Dubuque County. 5,307 people have been tested in Dubuque County and about 6% of the cases tested have been positive. 5 individuals are currently hospitalized and 188 people, or about 53% of Dubuque County positive cases, have recovered to date. Also, 971 Dubuque County residents have had serology or antibody testing. 57 of those, or 6%, have tested positive for COVID-19 antibodies. The state added 318 cases since yesterday and 1,118 cases since last Friday, May 29th. As of June 2nd, 2020, Iowa has a total of 20,016 positive cases. In all, about 1 in 19 Iowans have been tested, and about 12% of Iowans tested have been positive. 12 additional deaths were reported in the state since yesterday for a total of 561 Iowans. And 48% of all Iowa deaths due to COVID-19 are in those 80 years old and older. 266, or 47% of Iowa deaths, are residents in long-term care facilities. Currently, 292 cases are hospitalized throughout the state, and 11,705, or 58% of Iowans, have recovered. I've been giving a lot of instructions over the past 2 months. How to stay safe, how to social distance, even how to stay healthy during this pandemic. But do you or does anyone have enough information to make an educated decision about where we feel safe going and what we feel safe doing? I give current statistics every day to give you an idea of what's happening with the pandemic. For example, from today's numbers, you can tell that new cases are still happening in our community and throughout the state, and in pretty significant numbers, especially statewide. You know that people are dying, but our hospitalization rates are decreasing. You know the virus has hit the most vulnerable populations the most. In other words, those who reside in nursing homes, who are elderly, or who have pre-existing conditions. But you've also known or heard about younger people dying or becoming severely ill. With all the closures, restrictions, and public health measures being put into place, we are basically buying time, slowing the spread. We're slowing the spread so that we don't overwhelm our hospitals and healthcare systems. And so far, we've been able to do that locally and throughout Iowa. We've been slowing the spread to allow time for treatment or a vaccine to be developed. But think about it. Even if we do get a vaccine, we don't know if it will provide seasonal or lifelong immunity, and how will enough vaccine be manufactured or administered for the entire world. It will take time, significant time, to gear up for mass vaccination distribution. My point is, even if the numbers decrease over the summer, this SARS coronavirus 2 is not going away, and it's going to continue to infect people. The world and life's events will continue, including injustices and acts of kindness. So how will you react to current events in your community while a pandemic is going on? We can't let our guard down with our actions, practices, healthy lifestyle habits, and brain health well-being. We can still be active in our community, but think about how to do it safely and decrease the risk of COVID-19 transmission to others and yourself. Dr. Anthony Fauci recently said, "There is little chance that the novel coronavirus will be eradicated. It's so transmissible and it's so widespread throughout the world that even if our infections get well controlled and go down dramatically during the summer, there is virtually no chance it will be eradicated." That's taking into account global travel in the U.S. and everywhere. Cases in the U.S. went up by over 26,000 from yesterday to over 1,800,000. Not to mention another 696 deaths for a total of 104,396 deaths. Yes, the U.S. is leading the world. So as we try to stay involved and engaged with our family, our community, or place of employment, remember what Mr. Rogers said. Often when you think you're at the end of something, you're at the beginning of something else. That speaks to this time as the start of a new era. Thanks for tuning in today. Let's all continue to be safe, be smart. When in doubt, don't go out, or if you do go out, be safe about it. And remember, we're all in this together.